Hello, welcome to my podcast. Today I'm going to talk about another common case that you can see in the clinical setting, especially in the Afro young men. So basically, after you introduce yourself, double check the patient name and date of birth, ask the patient, how can I help you? The patient will say shyly that I'm having those irritating papules or nodule or bumps in the back of my head, and it's really embarrassing and it's affecting my confidence, especially if they are, for instance, looking in the job market whereby they rely in their outlook, and this is very important for them. So you need to be understanding, sympathetic, and empathetic in order to solve the matter for them. So it's basically it's a young black Afro man who's presenting with mild itchy, most of the time it's painless, solid mass or ash in their head, in the back, and the occiput. And they might have like a new haircut or a stylish like nowadays we see. And he's otherwise fit and well with no medical history of note. You'll tell them, do you have any medical condition that you suffer with? You say no. Do you have a medical history in the family? Some things. You might say yes. You'll ask if there is, what sort of job does he do and how it's impacting him and what he's doing exactly, just to have a touch of what he's doing and to understand the whole situation. Also, you'll ask if there's any history of medication or self-care that he does in order to get to the bottom of this problem. And also, you'll ask about the lifestyle, what sort of living, whom do you live with, what does he apply in his hair, and what sort of diet, and if he's doing any activity. And then you'll tell them that I would like to have close look and a lesion just to understand what's going on and put some, of course, differentiation in your mind. So we'll see there's multiple like exophytic masses or bumps, which could be irritated or might just not irritated, and range between 0.5 probably 1 centimeter in size. And he says it gets irritated when he brushes his hair or he pick the skin in the area, and it's really affecting his self-confidence and limiting his hairstyle options. And he might say that I have taken some medication before by my GP in the forms of oral antibiotic, shampoos, and topical hydrocortisone. And when you see maybe the shampoos he's using, you might find that he's using Nizoral or any antifungal shampoo. And he mentioned it doesn't work at all. So in this condition, you will think about certain differential, for instance, in that area, and it's the scalp. So basically, you'll think of tinea capitis, which usually in the form of coin-like lesion with hair loss, and it's well defined and clearing in the center, which doesn't apply in this condition. You might think of seborrheic dermatitis, which will shows like greasy yellowish scales in the sporia area of the face and the head, which doesn't apply in this condition as well. You might think of scalp psoriasis, whereby other parts of the body might be affected, or it could be merely in the scalp, and it has those thick, flaky things that you can't miss, which doesn't apply in this condition as well. And it could be boggy masses like Caron, which is acute inflammatory condition due to fungals, but doesn't apply as well. And then you are left with another common condition, which is called acne keloidal nuchae or folliculitis keloidis, which basically, as the name implies, is basically formation of keloid due to chronic irritation in the hair follicle, and this will lead to hair follicle occlusion, which leads with time to fibrosis, scars, and scarring alopecia. So the lesion, if it's really active, can be very painful, can be very itchy, can be bleeding with touch, and it could be with pustule. Back home, I remember seeing some of those cases. They were having really pustule, they're quite big, and they can be ugly as well, and mostly at the very end of the occiput in the back of his head. So the diagnosis is merely clinical. We don't need to do any biopsy. And as I say, over time, it gets fibrotic, which leads, of course, to those nodule, which is really hard in palpation, and could lead also to formation of plaque. And I need to mention about the risk factor or the triggers in this condition. It's mostly the hair cutting practices that they use, so they might advise your patient to refrain from those traditional cuts, or maybe they cut with a scissor, not to cut very short, or try to adopt a different hairstyle in order to avoid irritation or formation of those nodules. Also, if he's wearing a helmet, this might cause friction, so he could advise about a different helmet wearing. Like, for instance, there is the Milker Boy helmet, which doesn't reach to the back of the occiput, so he can use that. And it's stylish as well if they are looking for their style. And also refrain from wearing tight shirt collars, because this will cause irritation with the movement of the neck, and of course will cause them to bleed and itchy and get inflamed. And another condition also, the humidity. Is very humid, especially, as I say, I've seen those kind of cases whereby it's very humid and hot. It can trigger their formation. And because the Afro texture hair is more prone to this condition, because the fact of curled hair, and especially when the hair is curly and cut at short, it will re-enter the skin at short distance from the hair follicle of the existing, leading to inflammation. And we need to also not to forget about the genetic factor, which can play a great deal on those kind of conditions. So the management is basically, we need to avoid triggers, so you need to explain to your patient what's the reason for developing those kinds. So you need to counsel the patient quite thoroughly in order for them to understand the situation. You can give them a pamphlet or information and instruction just to read about the condition in order to orient and raise their awareness about this condition, because if you just read them merely without explanation, this will just cause vicious cycle and the patient will be totally dissatisfied. So you need to consult the patient thoroughly, and if the condition is mild, which can be seen in certain cases, we just treat with topical steroid, this one. There's a different topical steroid solution that you can apply. So you can tell them to apply certain times, not all the time, because it's a chronic condition, so they need to apply 13 weeks and then stop 13 weeks off in order to keep the momentum and not get the topical steroid side effect. And especially there's different strength of the steroid, so you'll start with the short strength first, and milder one, and then you can increase, of course, to the medium or the strong, but you need to inform your patient that you can't use this for a long term because of the side effects. And also you can give them antimicrobial wash just to keep the area clean of any microbe. And if there is element of infection, you will arrange for swab for culture in order to treat if there is any superimposed infection. And in such a situation, they can use also topical retinoid, which can help as well. And if the patient already has those kind of firm papule and solid ones, of course, in this condition, as we all know, nothing will help them, and refrain from removing them, because this will prone or increase the patient, because we know black skin is more inclined to develop keloid, and he's having keloid already. So if you think that you're going to remove it, I just, I'm gonna make the things worse. So you need to explain to the patient we can't remove them because those kind of skins and those kind of areas more prone to keloid, and we can't guarantee if you get more keloid, it can be even pronounced. So you will tell them about the kinacort, which is intralesional steroid that you need to apply for weekly interval, and you take it from there. And hope by that I just give you a glimpse about acne keloidal nuchae, which is common case. I do see it sometimes when I walk around the back of the head, as I say, at the bottom of the occiput. You can see them in the neck nab, and they're quite pronounced and can be irritating and frustrating for certain patients where it's going to apply. That's affected their confidence, so you need to understand what's the patient's main issue, main concern in order to treat it effectively. Thank you.